Good morning, viewers. Welcome to our Fosak TV. Here is a breaking and heartbreaking news from China. Almost 250 million people in China may have caught Covid-19 in the first 20 days of December, according to an internal estimate from the nation's top health officials. Bloomberg News and the Financial Times reported Friday. If correct, the estimate, which cannot independently confirm, would account for roughly 18% of China's 1.4 billion people and represent the largest COVID-19 outbreak to date globally. The figures cited were presented during an internal meeting of China's National Health Commission on Wednesday, according to both outlets, which cited sources familiar with the matter or involved in the discussion. The NHC's summary of Wednesday meeting said it delved into the treatment of patients affected by the new outbreak. On Friday, a copy of what was purportedly the NSC meeting notes was circulated on Chinese social media and seen by the reporter. The authenticity of the document has not been verified, and the NSC did not immediately respond to a request for comment. Both the Financial Times and Bloomberg laid out in great detail the discussions by authorities over how to handle the outbreak. Among the estimates cited in both reports was the revelation that on Tuesday alone, 37 million people were newly infected with COVID-19 across China. That stood in dramatic contrast to the official number of 3,049 new infections reported that day. The Financial Times said it was Sun Yang, a deputy director of the Chinese Center for Disease Control and Prevention, who presented the figure to officials during the closed-door briefing, citing to people familiar with the matter. Sun explained that the rate of COVID spread in China was still rising and estimated that more than half of the population in Beijing and Sichuan were already infected, according to the Financial Times. The estimates follow China's decision at the start of December to abruptly dismantle its strict zero COVID policy, which had been in place for almost 3 years. The figures are in stark contrast to the public data of the NSC, which reported just 62,592 symptomatic COVID cases in the first 20 days of December. How the NSC came up with the estimates cited by Bloomberg and the Financial Times is unclear, as China is no longer officially telling its total number of infections after authorities shut down their nationwide network of PCR testing booths and said they would stop gathering data and data on asymptomatic cases. People in China are also now using rapid antigen tests to detect infection and are under no obligation to report positive result. Officially, China has reported only 8 COVID deaths this month, a strangely low figure given the rapid spread of the virus and the relatively low vaccine booster rates among the elderly. Only 42.3% of those aged 80 and over in China have received a third dose of vaccine, according to the reporter conclusion of new figure released by the NSC of December 14. Facing growing skepticism that it is downplaying COVID deaths, the Chinese government defended the accuracy of its official tally by revealing it had updated its method of counting fatalities caused by the virus. According to the latest NSC guidelines, only deaths caused by pneumonia and respiratory failure after contracting the virus and classified as COVID death. Wang Guiqian, a top infectious disease doctor, told a news conference Tuesday. The minutes of the Wednesday closed-door NSC meeting made no reference to discussions concerning how many people may have died in China, according to both reports and the document with the reporter. The numbers look pulsable, but I have no other source of data to compare with it. If the estimated infection numbers mentioned here are accurate, it means the nationwide peak will occur within next week. Ben Cowling, a professor of epidemiology at the University of Hong Kong, told to the reporter in an emailed statement when asked about the purported NSC estimate. Behind the report, Fosak TV.